My name's Alison Foster. I'm the Programme Director for Building Berkshire Together. And Lynn?
Oh, hello. Yes, I'm Lynn Bushell. I'm Engagement and Communications Lead for Building Berkshire Together. Welcome. Thank you for coming.
Great, thank you. And what we do in these sessions generally, sometimes we have speakers, and we are hoping to get somebody in for the next one, but it's just us today. And we're just going to talk through the updates of what we've been doing over the last few weeks, and if anybody has got any questions that they'd like to ask, then we're here. It's just an open discussion. That if we were able to answer questions, then we can do that, and if we can't, we'll tell you, or we'll come back to you. So the first there's the things that are on my list that I thought we could go through is the new hospital programme review, which I'm imagining people might have some questions about. So we'll talk a little bit about the review. And then some of the work that we're continuing to be involved in is the impact assessment on the two sites that we've been looking at. So how's that going? What are the things coming out from that? How much have we got left to do with that? And are there any things that you might be able to help us with in terms of finishing off that impact assessment? And then we've also been looking at right-sizing our hospital and trying to get a team in to help us with those early stages of design. So as you know, we're developing our refresh of our strategic outline case. So that's the first part of the business case process, which sets out the case for change. In order to do that, we have to do quite a lot of costings and costings of different options, and to do that we need very high level designs. So we need to work out how many beds we need and what's the space that we need in order to, and that's when we open the doors in 10-12 years time, maybe sooner. When we open the doors, what are the beds that we're going to need? So we have to work with other organisations and our communities to say, what are the things you are going to put in place, like prevention services or early intervention services that might prevent people from coming into hospital. And so we have to look at all of those things, and what are the things that we might implement in terms of things like digital, different workforce models that might also mean that we can look after people, or people can look after themselves more at home and so need less beds. So there's a lot of work going on with councils and other health organisations, our ICB colleagues, to work out our bed numbers, and then we take those and we do what we call a schedule of accommodation. So it's what are the beds and theatres and outpatients and other space that we need, and then we work out the costings for those. So some of the work that we're doing is going to get a team to help us with that. So we need architects and engineers and healthcare planners to help us to do that work. So we're just at the moment scoping out and going out to tender for some of that. And we're also alongside that working with the new hospital programme team on the NHP library. So I'll come back and talk to you a bit about the NHP new hospital programme library, which is a mammoth library, which is developing a series of guidance on building new hospitals, from digital to floor space to air control to facilities to anything and everything, right down to a very good level of detail. So we are working to help input into that library, which is has already got a couple of hundred documents in terms of guidance already, but I can come back to that a bit later. So firstly is just to talk about the new hospital programme review. So as you'll be aware, Rachel Reeves, the Chancellor, announced a review. I think she announced it. I think what we've had a lot of questions around this review, saying does that mean the program's stopping? And some of it was related to her renouncing that at the same time as announcing a £20 billion or £22 billion hole in the finances. So people have assumed, therefore, that, reviewing the new, does that mean we're stopping it because that's where she's going to save the money? So it's an unfortunate connection, but the messages that we've had, and we haven't had the details in writing, we have had verbal briefings from new hospital programme teams to say that the review is not focused on whether there should be a new hospital programme, i.e. a programme that's got standardised designs and centralised processes, using modern methods of construction, trying to streamline the process of building new hospitals. That is something that this government have committed to doing in their manifesto and want to maintain. The issue is around the costs and the timelines associated. So they want to establish, they want cards on the table. How much is this going to cost? So what are each individual schemes costing, and do we agree with our costing? So there's a number, isn't there, of what the new hospital programme think we cost, and then there's a number that perhaps different hospitals, such as ourselves, I'm sure others haven't got as big a gap to fill as what we do, but such as ourselves, that says, well, we don't think that that's a true figure. They want to understand what the ask is in terms of the money, and they want to understand the time frame. So a lot of trusts have been told they've got to deliver by 2030 a new hospital. And RAC hospitals, so the ones with the aerated concrete, they're out of the scope of this review. So they will be pushed forward because there's an urgency to deliver those hospitals by 2030. But there are other hospitals that need to deliver by 2030, and because there's been delays to progressing their progress, it may not be achievable that they'll deliver their new hospital by 2030. So they want to understand, are the timescales realistic? And then the new hospital programme is doing the review, so they have to come up with a range of options for Treasury. So it's here's how much it costs, and if you were to go at pace to deliver it, this is how much it would cost per year. So they're looking for a cash flow situation. So how much is it per year in the next sort of term that it would be if we went full steam ahead? How fast do we need to go to deliver these programs on time if they were to deliver, some of them to deliver before 2030? What would slowing down look like? So that is an option that's being explored, is what does going at different timescales look like? And those are the kind of options that being pulled together. As I understand it verbally, we've been told that review has been carried out and some options put forward. And there's now, as with these things in government, a whole process to put it through different departments. So it's to go through the Department of Health and to be tested and challenged, and then to go through before it goes to Treasury. The aim of coming out with the results of that is to feed into the autumn statement at the end of October. So that's the hope. Whether that will happen, don't know. But the autumn statement at the end of October is what people are aiming to have some answers for. What we've also been told is that it's likely that, because what they're looking for is how much will this cost per year, is that they will need to give us our indicative, or they'll need to give an indicative number. Whether they give it to us directly before that time, I don't know. But it's likely they will need to review what our allocation is in order to make those numbers. How much do we need each year? Again, none of this has been put in writing, so I'm only giving verbal what I've had verbally. The big message, I guess, is no one has said the programme's finishing. There's been positive messages about it is continuing, But the new government just need to know what they have to deal with, right? They just have to understand a bit more of the detail and have their own review carried out about what needs to be done and what are the options in terms of how we get it done. So I think that's really, really positive. Has anyone got any questions at this stage on the review? No questions. Wow.
Oh, hello. Sorry, it's B. Sorry, I couldn't unmute myself there. Hi, you
No.
okay?
Hi.
I can't remember, where is Royal Berks currently in the like the categories? Is it not categories? I can't remember what the name for it was, but at one stage I think there were 4 kind of state phases of the project. Where is Royal Berks currently sitting in that?
So I mean, I think you were talking about cohort 4.
Yeah,
So,
cohorts, yeah.
Yeah. So cohort 4 was the purpose of cohort 4 was that we were going to be full adopters of the new way of doing new hospitals. So if you were in cohort 1 or 2, the standards and or 3, the standards and the guidance won't have been developed, so you won't be building your hospital according to them. In fact, you're building your hospital and the learning from those hospitals will feed into the future guidance. So, so that's the first thing. Cohort 4 people, which we are, will be full adopters of the new way of building a hospital. The other thing was that we were, until last year, we were supposed to deliver our hospital before 2030. But with the introduction of the RAC hospitals, so the aerated concrete hospitals, and there was 5 whole new hospitals that have to be built. There's 7 in total, but 2 are already on the programme. A few hospitals got pushed back to starting construction in 2031, and that's where we are, starting construction. And I just want to qualify with the starting construction. The build or the construction is the build of the hospital, but there is a lot that can and should be done before you start constructing the hospital. So we have to, you know, if we're moving off site to a new site, we have to identify that and buy the land. We have to make the land good. We have to put in things like, you know, in advance, it might be car parks or energy centres or things that you can build ahead of starting actual construction in 2031. So I know it might feel like a long way off, but actually it's not that long. It's not that far when you consider buying land takes time, but also planning permission takes time. A public consultation takes a huge amount of time as well, which we would need to go to if we were to move. So all of those things do take time. So a 2031 construction time at this stage doesn't feel too unrealistic, actually, for us if we were to move, if we were to get funded and move to a new site. Does that explain?
Yeah, it does. Thank you. And I think I was just thinking, does that affect the review? But it doesn't. It doesn't sound like in any way it affects
no, we think
the review or vice versa.
Yeah, we think that. Well, it's, you know, we think that the people probably most affected by the review will be people who are expected to deliver something before 2030. So,
okay.
Because if everybody did, that's quite a lot of, for a start off, money going out every year to build these hospitals in the next 3, 4, 5 years and some of them may or may not be ready. So it's much more likely, we think, to affect that group rather than later groups.
Thank you.
Okay. Ian?
Ali, I wonder if I could just ask you, the costings and for the review that you put forward, have you put forward costings for just a new build on a new site or on the existing? Have you done both or just for a new site?
So the costings, so the reason why they could do the review actually relatively quickly in terms of desktop review is because they used, so if you remember, they were about to go to ministerial sign-off for the programme business case 3 in May time. And just before the ministerial sign-off process, they called a general election. So there's a lot of information in that program business case, which was done last year around costings. So we put forward they already have costings for building on our current site, and we put forward our preferred costing, which was to build on a new site. So and the new hospital program submitted those new and updated costs. They were taken from a should cost model. That's what it's called. We did some modelling on what a new hospital and a new site would cost, and that was put forward by the new hospital program on our behalf last year. So what they have now is what we've asked for in terms of a new hospital and a new site.
Thank you.
Okay. Mike.
Yeah, I was just really slightly surprised that the government are calling in everybody to review their plans so they've got a better handle on the money when the programme was supposedly quite advanced under the previous administration. So the costings you've just talked about, where you've put in costings for a new hospital on a new site, I mean, when were they last reviewed in terms of inflation and construction costs? Because the two are moving very independently.
So there were some costings done last August submitted, and then they were reviewed again our costings were reviewed again in March this year. So there is a constant review against inflation and construction inflation that happens, but so it is relatively up to date in terms of those costings.
And how do they compare with all the other hospitals in the programme? Are they all putting in for a similar bid, or is ours down the low end or high end? Or
well, so the new hospital has a variety of schemes. So some are just for a separate building. So we've got some that are like a women and children's block. That's considered a new hospital. So there'll be some that are just a block, and at the lower end, I'd say ours is probably at the higher end because we're asking for a whole new hospital. Similar, like Frimley is having a whole new hospital because they're a rack scheme. There are 7 racks, so they're having whole new hospitals. Not sure how many other whole new hospitals there are, but we're at the higher end if you look at the scale in terms of our ask for funding.
Thank you.
Okay. Anything else on the review? So we're hoping to hear in the next few weeks. I feel like a broken record. I keep saying we hope to hear something in the next few weeks because there's always these reviews happening, but it is to be expected with a new government. And one of the things that they are trying, the new hospital program have said that the new government are trying to do is to give a multi-year level of certainty so that we can just get on with so we can just get on with it and everyone have a plan and just be in implementation mode. That's what they're trying to do, but these things are easier said than done, aren't they? It can be much more complex than we give them credit for. But hopefully we will hear in the next few weeks before the autumn statement, or we might hear with everybody else during the autumn statement what's going on. So that's the review. So if I just talk briefly about the impact assessment. So you all probably know that we've been looking at 2 sites as part of the options appraisal work for the business case. We do the next level of detail in terms of looking at a new hospital and a new site. So we did a higher level of detail in the initial strategic outline case and some high level costings, but now we need to get into how feasible is it. So some actual costs that will work through with people like utilities, looking at cost of land, looking at due diligence, is the land viable? But most importantly, if we were to move, what's the impact on patients, on visitors, on staff, on communities? So the communities we move the hospital to, and in fact, the community that if we move the Reading Hospital, what's the impact on that community? And then we look at what the risks are, what some of the risks might be to moving, how we might mitigate against those. So a big issue with moving is travel and transport. And whenever we do any events, it's always top of the list is access, because that's what people are most concerned about, is how do I get there when I need it. And so there's lots of sections to the impact assessment. Travel and transport is a huge section in there. There's a section on health inequalities. There's a section on the impact on communities, the impact on the economy. So there are some real positive things about building a new hospital and what that might bring to the local area. So it's a huge, we're hundreds of pages of work that's going into looking at the impact for patients, for staff, and for the communities. And we've had a survey out as well, which has been doing really well. How many have we got up to now, Lynn?
I think we were 8,360, I think, as of this morning. So
which
like
is great. So and people are letting us know how they feel about having thanks B about the move. So I don't know if you've got some highlights there, Lynn, because I know you've been leading on the survey, which is
I have.
Great.
Let me just get the right window up. So can you all see that?
Yeah.
Okay. Again, I appreciate we sometimes do these and then end up putting loads of words on a page. So the key thing to look at here, I think, is the chapter down the left, which was what Ali was just explaining. There are a number of chapters, and then we'll just have a little brief look at those chapters and whether they've been a positive or a negative impact so far. So what's happening at the moment is that we have got another week tomorrow till the survey closes, the 13th of September. And alongside that survey, we've also been doing smaller stakeholder groups. So we met with a number of community leaders. We've got Alice on the call tonight. We met with Health Watch. So Alice is one of our Health Watch representatives, leads in the area for Reading and Wokingham. So we met with Health Watch, we've met with Public Health, we've met with our ICS. So a real range of sort of stakeholders that we've met with. So to sort of supplement that, we did the survey, and we've been looking at each of these key metrics, which is a super formal word for really looking at sort of what the chapter needs to cover. So just to run you across, we've got 3 symbols to look out for. We've got the Libran scales, as I like to see them. So that's a mix. That means there's a mixed impact. We've got the cross, which is a negative impact. And then we've got the tick, where we felt that there is an obvious positive impact. And as I say, the next piece of work is really digging into the survey, looking at the sentiment analysis and looking at what people have really said in those comments to make sure that we are not missing anything, and to make sure that from our initial discussions with the community leaders and our key stakeholders, that we have understood this correctly. So what's happened is, I'll just run you through a couple of them. We won't go all the way through, but the traffic and transport, as Ali said, is always a key and hot topic. Not only how we're going to get there, but also, are we going to be able to park? Will the bus be dropping me on the outside? Will I be able to walk to the new facility? So what's happened is we have judged 2 facilities. So TVSP, just to remind you, is Thames Valley Science Park, and that is located off the M4 near Shinfield Studios. And Thames Valley Park is at the end of the A329M near the Sutton Seeds roundabout, which is where Microsoft, Oracle, David Lloyd are situated on the business park there. So just to remind you of what that is. So if we look at the travel, the key metrics which we've assessed, and we were lucky enough to have a consultancy to help us really crunch the numbers of where our patients are living. Hold on one moment, someone's just trying to get into the meeting, so make sure I can let them in. Thank you, sorry about that. I've lost my thread completely. So the key metrics that we've assessed here, we were lucky enough to work with a transport consultancy for this part, because they have taken postcodes of the patients, postcodes of the staff, and they've really analysed how people would get to work and how people would access these two locations. So they've crunched all the numbers and all the postcodes and the travel times. So we've looked at travel time impact, and that's not just for driving, but that was by public transport, cycling and walking as well. And we've also looked at the travel infrastructure. So really looking now at what infrastructure would need to go into place to make those two locations work if they were the selected locations, if we were to move off site. So they've really looked at that, and it's come out at the moment with a mix of positive and negative. So now what we'll do is we'll drill down into those positive and negative, and we'll say, okay, if there's negative impact, what are the mitigations that we can take? What are the things that we can consider in our design or in the location to make sure that those negative impacts are reversed? So I hope kind of that makes sense as to what our next stage is on the impact assessment. And I think another interesting thing here is our health inequalities impact, which is the second chapter down. We've done quite a lot of work trying to look at what would be the impact for our protected characteristics, our community with protected characteristics. And this is a real range of characteristics. And it includes also our vulnerable groups as well. So we're really looking at the communities who may have poorer health outcomes if we let them. So and that's absolutely not going to happen. And what it's showing so far is that both of those moves have got negative impacts more than positive impacts. So we really need to work hard to make sure we have really looked at what the negative impacts might be so that we can mitigate against them. So the intention is to not just plough ahead and say, oh, well, negative impact. No, this is where the hard work happens now. We've also got a negative impact on the health services for TVSP, so the Thames Valley Science Park. And again, that's looking at about how our patients might access diagnostics or our inpatient services, and also looking at our emergency department travelling to there. So we're doing some work with our ambulance service, our blue light service as well. On a more positive note, we'll pop down nearer the bottom and we look at the economic impact and the stakeholder feedback. And what we've received so far is more positive impacts than negative for both of those. So there is certainly an economic benefit from building a new hospital in terms of recruitment and retention, and in terms of what that economic impact might have on those two locations. And certainly from our survey so far, we've had real positive feel for both of those sites. There is one that's more popular than the other, which we're not going to talk about at the moment, just because that's going to come out in the summary. But if it was a vote, which it's not, there is one that seems to be coming out as more popular than the other. But the general feel is that the impact would be good for staff, residents, patients and businesses. So on the whole, we've found a more positive outcome. So it just gives you a real glimpse into where we're at the moment. And now, as I say, the analysis will kick in. Just trying to think what else we've got on these slides. Yeah, that's me, Ali, with a very brief overview of where we are so far.
Thank you. And it's just to say, and there was a bit of a slide there on the process. This impact assessment is an information gathering exercise. It's not a public consultation. It's not even a process where we make decisions around use this, and that we will contribute. It will contribute to what we call a pre-consultation business case, which is a technical document, so have lots and lots of information about all of the options, and then that needs to be approved to take forward the information to take forward in a consultation, and they'll be looking for things like making sure that in consultation we take forward, just make sure that they're viable options. So we're not going out to the public and saying, for example, do you think we should move to a new hospital on a new site? But by the way, we haven't got any funding. That's a key question. We have to make sure that by the time we get to consultation, the options that we're asking people to comment on are funded options. or are affordable options. So that's the work that we're doing now, is gathering that information from things like the impact assessment. One of the things, we talked about highlighting risks and mitigation, access and getting people to a new hospital and a new site. We need to look at the costs and timeframes for those, and those are the things that will be in a technical document to put forward, whether it's affordable option for consultation. So it's a long and process, but it's just saying to you that this impact assessment isn't the consultation, but it is information gathering, and that's why it's so important for people to be contributing. So it's we're really happy with over 8,000 responses. It shows that people are engaged and interested, and if there's any comments at all or anything about moving that you've got, then do let us know, because it just feeds into that. There are things we don't know what we don't know, and that's the whole point of going out and asking people. Thank you. If you can hear whinging, it's my dog has his friend over, so I now have two pugs in the living room with me, and they're not behaving at the moment. So I don't know. My husband has locked the two of them in here. I'll have words with him afterwards, because I shouldn't be locked in here with the two pugs when I'm having a call. So don't know there'll be trouble when I get off here. Ian.
It's actually his wife Penny who's got just a comment. I think it was terribly unfortunate that those two sites have got such a similar name. I honestly think that there will be a number of people who are completely confused about what they were talking about, which site they were talking about. Anyway, I mean, it can't be helped and it's done, but it's very unfortunate.
Could I also ask, how sure are you that the survey is representative of the people of Reading? And also, I wonder if you could comment on that first chapter, transport, access, and so on. I mean, as you would expect, asking 8,000 people, you're going to get mixed responses to pretty much all the questions, and the majority does seem to be mixed. I just wondered if you could give us, not the specific figures, but in terms of transport and access, what is that sort of mix? What sort of percentage are we saying is for or against a particular site?
So we've really focused the transport and travel on people's postcodes, and the percentage of people that are car drivers and the percentage of people that are currently traveling, how they're traveling to the hospital at the moment. So we haven't focused too much on the survey for travel and transport, because you're absolutely right. Depending on where you live at the moment, with your current health concerns, your current ability to drive or get a public transport, it's going to be mixed, and it is completely mixed. And as I insinuated, there is one that's tipping the balance, with people saying they feel more positive about one than the other. But you're right, from a travel perspective, it will be mixed. So we've really focused on people's postcodes, the current infrastructure, and then what the infrastructure could be. And as Ali said, we'll look at the costs on those. So I haven't got percentages to hand for that particular one. Going back to your question about how do we know it's truly representative of our community, we've taken some demographic information, which is used purposely for that, to ensure that we are looking at our communities. And what I've done is I've kept an eye on that survey to ensure that, for example, we know our population spreads right out from the villages of West Berkshire right through to sort of Maidenhead, almost Windsor way, with the Prince Charles I unit, which we've got out there. So we do have our population there as well. And what I could see was that, I wasn't getting very much from the West Berkshire villages. And that's really important, because actually, when you speak to anybody who lives in a West Berkshire village, I don't know if we've got anybody on the call today, as soon as you say we're moving East Reading, oh my goodness, I'm going to have to drive all the way through Reading to get to an appointment. It's terrible at the moment. And I've had some really interesting feedback from people like patient drivers, volunteer patient drivers. So I went to West Berkshire to do an event, And I managed to speak to somebody from a couple of the volunteer centres there, and they were saying they've got 35 volunteer patient drivers, and only 5 of them will come to Royal Berkshire Hospital at the moment, because we're just not set up to do drop-off, you know, to be able to drop patients off. They've got to deal with the congestion and the traffic. So when I said to them, right, well, what can we do? If we build a new hospital, what can we do? And they said, well, actually, the roads will be much quicker to the A3 on the A329M or the M4. So that might cut down some time, because we won't have to go through Reading. And, you know, please bring back a drop-off area for patient drivers and patient transport, because, you know, it just doesn't work. And somebody else chipped in, we need more, you know, disabled spaces. You know, when you're ill, you're poorly, you're sick, or you've got a disability, you don't want to be on public transport. You don't want to be, you know, on a bus with lots of other people. So people are reliant on taxis and getting lifts from neighbours and friends and family. So these are all things that need to be factored in, you know, when we're talking to patients and we're looking at how it might affect the design or where the hospital might be. But we will be putting some more sort of detailed percentages and demographics into our summary and obviously our final report, so that will be shared with you. Thank you.
Mike.
Oh, sorry, Ali, but I wasn't sure if you were there. I couldn't see you on the screen.
Can you hear me? Oh,
yeah, no, you're there.
Okay. I had to mute it. I've got rid of the dogs now. Mike.
Hi. Interestingly, that you know, you put a lot of effort into the 2 shortlisted sites, and yeah, Thames Valley Park is ideal for many reasons, but probably not if you live in the West End of Berkshire, which I had a particularly high number of people on my buggy today from that end of the county, for some reason. But what surprised me, I was talking at the weekend with somebody who's in touch with a number of staff. He's an ex-member of staff. And it seems a lot of staff are not aware that there have been 2 sites shortlisted. A lot of them are still talking about, oh, Green Park, Green Park. So I know there's a lot of information being put out, but it doesn't seem to be getting across to everyone.
Yeah, it's a challenge. We did a all-staff briefing, which our CEO, Steve, and our Chief Strategy Officer ran. And we had something like, I think it was like 270 people logged onto that. And then we did a number of staff briefings. I think we had 75 staff come and do face-to-face kind of workshops. We've got, you know, an internal, what's called Work Vivo, like an internal intranet. We've been in the staff bulletin. So it is a challenge. It's always a challenge, particularly with clinical staff who are busy and they're not on their computers, and we can't rely on sort of digitally contacting them. We also had signs up in the restaurant. We've used some of the digital screens around the hospital as well to try and encourage staff and patients, but we don't always hit everybody. We've learned so much from these engagement sessions, so much, and as the programme has continued, I think we're going to be very well set up to nail consultation, because we've learned so much, and we know that's the formal one, that's the one where we, you know, really need to get to everybody. So it's good feedback for me, Mike, to hear that there's lots of staff that still don't know, because it's a challenge. And if they've got ideas on best ways, you know, we try and do cascades through managers, we try and go to the staff areas and put posters and pick, you know, things up. But yeah, it's a challenge to get people engaged. And I think until we've got a big banner on the side of North Block and on the you know, main road at Craven Road saying, you know, we need you and we're moving, or you know, then we're not going to get we're not going to hit them all.
Perhaps you need to shove something in their pay advice notes.
Yeah. Although, yeah, it'd be interesting to see what the opening rates of that are actually on payroll. I'm sure they're probably pretty high.
Thank you.
Thanks, Ian. Thanks, Mike. Ian.
Just another thing on the terminology. In that, I think you need to amplify what this actually Building Berkshire means, because when I first saw that, I thought it was all about the county of Berkshire. It didn't actually mean to me directly the Royal Berkshire Hospital. And I just wonder how many people, you know, haven't quite grasped that that's what your name means, you know, whether you need to amplify it, make it clearer.
Yeah, we do always try and say our new hospital program afterwards, but I take your point. And I think, yeah, there's been a little bit of there's been not reticence, the wrong word, but there's been a little bit where because we can't answer a lot of the questions that people, the main questions people have got, all they want to know, quite rightly, you are all included in this, is, how much money have you got, and when are you going to build, and where are you going to build, and because we haven't had those answers, the engage, it's felt so far away for people. So I know Ali will share this, but we are really looking forward to some concrete decisions and some real things that we can say, brilliant, we are definitely starting construction this, in a particular year. This is the work we've got to do to achieve it, and we can work back and really, share that information with you as the public and members of staff, and start being able to, really imagine what we're going to get, because it's felt like we've had a few setbacks with it, but we're working hard on that.
Kate.
Thanks, Ali. So Lynn, I was just thinking back to the when you were mentioning about the commute down to the new sites, where it be TVP or TVSP. It got me thinking about the standard of time that the average patient stays in the clinic, because last 2 weeks ago I went to Oxford. It took me 2.5 hours to get there. I was actually in the clinic for 5 minutes, which was absolutely unbelievable. So it's commute and clinic. And combine make the most of the time, because if the site's away from the shops, I mean, I know someone that walked from the hospital the other day back into the shops in the town, because they had ample time before their next clinic. And I thought, oh my God, if that's a new site, where can they go that's not within the hospital environment, that actually can give out their time to do something constructive before the next appointment?
Yeah, thank you. It's
and also, I had an idea about having, because obviously everyone has been targeting the survey online, which is, don't get me wrong, which is fantastic. How about if those that don't have access to the internet, and that's not just because they've not got family to access it for them, or they've got someone to talk to it for them, how about if there's a great big sort of like a notice board going down? I'm thinking about South Block corridor at the moment, so that anyone that has an idea can stop at the wall and then just write on the notice board on the wall. So then you can then take it away at the end of each month and say, right, this actually has been mentioned already. This has been mentioned too many times. And then you can bring it back to the meetings once a month.
Yeah, no, we need that creativity, and kind of language and translation and easy read. They're all things that we have to prioritize.
I mean, also, I've been, as you know, talking to David Manders, who's the facilities manager, but the others don't. And I was talking to him about Access Able, and I've got plenty of apps on my phone, and they all, as you have both seen, Lynn and Ali, different days, you've both seen how the patient with the colour blindness or the eye condition have seen the site, and about seeing the signage of the site currently. And I said to David about it last Friday, actually, in a lunchtime meeting, about the fact that if you find a very long corridor, which is notably with the pharmacy, the Lloyd's pharmacy in it, then actually some people cut through that way to get down to South Block or maternity, rather than having to go past an unnecessary departments such as X-ray and other places. Because of the influx coming out of those departments can hog up the corridor as well as the buggies, because that's also the less used corridor for the buggies. But it just got me thinking about, actually, where on earth else can you put the notice board? Actually, what is the vision the new hospital can be placed within the eye department? Because I mean, whenever I've been down there, it's been absolutely packed. And I mean, literally, you're just having to wait. You're having to get people to ask if they're actually a patient in order for them to have their seats, because it's just ridiculously busy down there at the best of times.
Yeah, we've talked to quite a few people who are waiting at the pharmacy and things like that. It's been quite a helpful way to talk to patients and
absolutely,
get their opinion. Thanks, Kate. It's really good to have some creativity, some good ideas.
Anybody else? Any other questions on impact assessment? So if there isn't anything else on that, just very, very quickly, just to talk a bit about the other pieces of work that we're doing. So, and I guess this reinforces, so although the review has been announced, we've been told to just carry on with the work that we've been doing, so to push ahead. One of those is right sizing the hospital. So the work that we've been doing is with a central team in the new hospital programme who've got data from across the country and have a clinical expert reference group that feed into right sizing a hospital. And so they take things like demographics, housing growth. Many of you may or may not know, but there's been recent housing quotas have been increased for certainly across the country, but for some areas in this patch, some of the housing that they already had to build has gone up by 75%. So there's something like 3,000 houses across our Berkshire West area per year quota is being built. So it's things like that we need to take into consideration around driving up demand. Usually for these kind of houses, so one thing to say is when houses are being built, the demand is greater in the primary care area. So the people who move in are usually younger family type houses, the majority, not all, are. So they take up a lot of the primary care demand. So we are working across the system to work out a combination of the things that are driving up demand and what are the things that we can do to ensure that the hospital that we build has got the right number of beds in particular. And the other thing that we've been asked to do from the new hospital programme is to ensure that we've got some expansion space, so that we build a hospital and we make sure that we've got, because we want a hospital for many decades, and we can't be sure of what we might need going forward. So both of the sites that we've are looking at has 25% expansion space in terms of outwards. So that's not upwards. So there is potential for upwards should it be needed, but that will all depend on issues and planning. But outwardly, we have a 25% expansion space where we have, which is actually not that easy in land near Reading. There's not a lot of land near the Reading area. But anyway, we've got 25% expansion space in both of those areas. So that work we'll be continuing to do for the next sort of over the autumn period, while we bring in the team, the multidisciplinary team, to then help us to use that information about the size of our hospital and look at some early designs using potentially the land that we've identified to look at what is possible in those two areas. And all of that will feed into a public consultation. In terms of timing, it's looking at the moment, if we carry on and there's no delays to what we hope in the programme plan, we anticipate going to consultation in spring or autumn next year. It's not very good to do a consultation over the summer. If we do, it will either start in the spring and end in the summer, or start in the summer but end in the autumn. To do it just over the summer would be not very good. So it'll be either side of that is our current plan. And the consultation usually lasts about 3 months in terms of having people being able to contribute, and there'll be lots of different opportunities. So I mean, I've been writing down, actually, even in the impact assessment, have we spent a few days in A&E talking to people, because there's just people there waiting sometimes for hours, and actually doing a survey for some of them just might be something, or in outpatients areas. So, and I know that people like yourself, John, and some other patient leaders that we work with love to do things like that, is talking to other people and getting information. So we still have some time with the impact assessment, and some of the suggestions here about staff and doing another push out to staff on some of this, and maybe capturing some of those patients who are in high volume areas, we might be able to do with the help of some of our patient leaders. So that might be really good. And I like the idea of when we do get to the consultation of big banners outside the hospital. You know, we have got big spaces out there, so you know, and particularly to capture staff who are going to be walking in there and out there every day in different shifts. That might be a really good way of doing that. But I think just from this discussion that you know, we've got a little bit of time, we could maybe see if we could do some of that, if we could have some help from some patient leaders. John, I'm volunteering you. And yeah, finally, it's just to say, so on top of the work that we're doing with the impact assessment, and that goes to governance in October. So what we mean by that is it needs to be signed off by our board, but it's going through various different groups at the moment to check for factual accuracy, check we haven't missed anything, checking with people like the planners in the local council, checking with public health colleagues, you know, have we captured it? Have we captured everything? So there's a lot of people that we're checking in with around the drafting at this stage. And then it goes to our governance in October. We've got the work on bringing in the multidisciplinary team, and we've also got the work on the NHP library, which is a task just to read it and to be proficient in it and ensure that we're all, the different specialist areas know that there's new guidance and know how it might impact, know how different it is from what we currently have, and also be able to contribute any issues that we might have. So we have had some early designs of ICU and a couple of other areas circulated across the country. And there's been lots of comments back on some of those areas. So before we engage with patient and public groups, that's got to go around the experts and doctors and nurses who are working in those areas first, and then have an iterative process, and then there will be a process where that will be opened up to patients and public to be able to contribute to that. So it's not at that stage yet, it's at the really early stages, but we're starting now to see some designs coming through. We will have, by the time sort of in the next few months, we are also working on using our virtual reality equipment. So we've got some equipment where we hope that people like staff, patients, public will be able to come into a space and put the goggles on and be able to look around spaces as they become much more defined. So we're also working on that. So there's quite a lot of work on that, and then there's other national work in terms of commercial frameworks and all of that we have to input into. So just gives you a bit of a flavour of the work the team are involved in. Ian.
Thank you, Ali. Sorry to keep asking questions. I wonder if this is just about clarification. If you're dreaming of going out to consultation in spring and autumn next year, does that imply that by that stage you will know exactly what the funding is?
Yes, so we have to know what the funding is before we're able to go to consultation. In fact, we have to know a lot sooner than that, because I think there's a date where we say, if you don't tell us by this date, you're then pushing our program plan back because we can't progress without knowing. So for example, doing designs, we can't be working up designs that we're going to cost if that option isn't affordable because we haven't got a funding envelope. So it's actually quite soon. It's October, November. If we don't, so we're pushing ahead, and we've got a program plan that we've talked through with the new hospital program. We're working through that, but we'll get to a stage towards the end of October, beginning of November, where if we don't know, then we can't commission that work on the design. We can't move forward. We then start incurring delays. So there will be an imperative to know quite soon, actually, or to know if we won't know.
I think, given the way the government is cutting back on all of financing, is most of your work directed at a new build? My reason for asking that is, if that is the case, is there then going to be another long delay while you look at all the design or redesign or reallocation of buildings within the existing site?
So we've already done lots of work around design on the existing site. We've recently done the viability study last year, which contributed to saying we need to move, but we had to do a lot of design and costing work on the current site. Not sure if I mentioned here, but that viability report did some designs that said it will take 26 different moves and 14 years to redevelop the whole site. And so that was done to a level of detail and costing. So there was a costing done with that. So we do have some design. We've got other options. We've got different variations of that design. Should we have to think about chunking it up, phasing it, and redeveloping the current site because we haven't been given enough money to move. We do have lots of those designs ready to start to push the button should we need to.
Thank you.
Okay. Anything else? Right, we've got 2 minutes. Oh, John.
I've got the symbols somewhere around my screen. Just a query. 2 sites are constantly mentioned. How certain are you they're going to be available over the next few years?
Yeah, it's a good question. Both of them are not technically on the market. I.e. they haven't been put out to the market because the owners want to sell to the NHS at the moment. But I think if we in our discussions there will be an imperative for them to sell if we don't move in the next year to 18 months to progress one of those. They will look to put it on the market. So I think we've got probably an 18-month window.
So hopefully we'll know about finances, etc. by then.
Yeah. Well.
Dear.
And we have had some very good meetings. We've I can't remember when I mentioned it last time, but since the election, we've had all the MPs come and visit and talk through what they can do to help and work together to help us to get a new hospital. So we've had mainly Liberal Democrat and Labour, because it's been a complete change of colours around us. But they have come and today they're coming from different perspectives. So Yuan Yang, who is the MP for Woodley and Early, put a question in the House today, 10 past 10, was it, Lynn?
It was.
Which asked the business secretary if she could come and talk to her with businesses, life science businesses in particular, and the new hospital, who is a global, not new hospital, Royal Berkshire Hospital, we're a global exemplar in clinical research. And could we talk about how we can increase investment in this area in the Thames Valley? And she said yes. So we've got a meeting with the business secretary to look at that. So that's coming from the perspective of one of the cases for change is the ability a new hospital has to attract investment into the area, particularly in the area of life sciences, but other areas also. And so there is some proactive work with, I know Clive Jones has been lobbying, so he's the Liberal Democrat MP in Wokingham, is also a hospital governor. I don't know if he's still a governor, but he's been a governor for a while. So we've got some proactive MPs also working to help push us on that priority list. So I'm not sure there's much else we can do at this stage. So fingers crossed.
Just a point of interest, Clive Jones gave his maiden speech in the House of Parliament yesterday, where he specifically mentioned how proud he was of the RBH for having saved his life twice, and that he is still a governor.
Right, great. Hot off the press. Thank you, Mike. Yeah, no, it's great, and he's a great advocate for the trust. So it's good. Okay, thank you very much. I will let you go and enjoy your evening. Thanks for joining again, and as always, just email if you've got any questions, and we'll look to have a different speaker and new faces for our next session next month.
Thank you.
All right, thanks a lot. Bye bye.
Thanks.